We have our next question. So it says an 82-year-old man presents to the emergency department of ambulance complaining of chest pain. 8 hours previously, he began to experience dull, crushing chest pain that radiates to the left arm. So it's typically angina pain. There is associated dyspnea. Okay. He also describes feeling very nauseous and sweating a lot. He hoped it would go away when he finally decided that something must be done. He called 911. Okay, it's not essential, non-essential information. So vitals, afebrile, pulse 128, it's high. Blood pressure is 168, 92, it's high. On physical examination, the patient appears moribund. He's breathing 100% oxygen through face mask. He became chest pain free on aspirin, IV heparin, beta blockers, nitrate, and aptifibetide. 12 hours after admission to the coronary care unit, his blood pressure drops to 103, his pulse rate 126 per minute. So previously the blood pressure was high. When after the treatment, the blood pressure drops, and also the pulse rate was 126, and jugular venous distension. Okay, auscultation of chest reveals scattered rales and wheezes. Okay, so we have three clues now. Okay, so the and auscultation reveals absence of murmur and rumps. So actually, what is the most likely diagnosis? So actually, the question is asking about the complication, post myocardial infarction complications. So what complication is described here? The findings. Look at the findings. The lungs, it showed rales and wheezes. That means there is congestion in the lungs, or something is wrong with the left heart. No murmur rub, so that means no valvular heart disease, heart involvement, or anything related to cardiac murmur, because there are no murmur rubs. So we can conclude that something is not wrong with the heart walls. And as the lung shows congestion, like auscultation revealed scattered rales and wheezes. That means something is wrong with the left heart. If you can see, this is right heart. I cannot do this. Sorry, I cannot explain it to you by drawing it, but simply just listen to me. Like, if something is wrong with the left heart, the blood will back up in the lungs, and also on the right heart side, because the blood, it goes from right ventricle to the lungs and then back to the left heart. So if the left heart is not pumping, or left heart, there is something wrong, the pathology is involving the left heart. So the blood cannot flow from lungs to left heart. I'm just explaining in simple terms. So the blood keeps on backing up in the lungs, so that why lungs involved, it shows congestion, which is the findings related to that is scattered rales and wheezes. Or if we can order chest x-ray, you can it shows pulmonary edema. So look at the options. It shows cardiac tamponade. Since uh, the in cardiac tamponade, you hear the distant heart sounds. You hear pulses paradoxes. That is classic finding. And also, cardiac tamponade, it happens after 5 days. So it is too early for cardiac tamponade to occur right now. And same is the case with free wall rupture. Here I want to show you one thing, that since whenever you see two options that are same, like cardiac tamponade and free wall rupture, they are same. So both of the options are incorrect. So it is a trick, but it have this the free wall rupture and same cardiac tamponade, it happens after 5 days. And congestive heart failure, yeah, it could be the reason, because we have the congestion in the lungs, the hypotension and jugular venous distension. The all findings are typical for congestive heart failure. Papillary muscle rupture, same, no, it is incorrect, as there are absence of any murmur, so this is incorrect. Right ventricular infarct, this is also incorrect, because as you see, the lungs are involved. If you have the involvement of lung, always think there is something wrong with the left heart side, not the right. If right is involved only, then the lungs, they are fine. There are no rales wheezes or no pulmonary edema or pulmonary congestion. You can see jugular venous distension, but you cannot the other findings, the involvement of lungs, it never happens whenever there is right heart involvement. Okay, so the most probable and the most likely diagnosis is the congestive heart failure. Okay, so let me show you the explanations. Yeah, the correct answer is B. As you can see here, the patient has developed post myocardial infarction complication of congestive heart failure. The presence of hypotension, tachycardia, rales on auscultation of the chest point toward the diagnosis. The absence of murmur essentially exclude valvular rupture, as I told you, and papillary muscle rupture. Okay, as a diagnosis of papillary muscle rupture leads to acute mitral regurg and pansystolic murmur. Yeah, I told you, because there are no heart murmurs, so this is the wrong option. This patient does not present with clinical sign of cardiac tamponade. Okay, first, patient with cardiac tamponade have clear lungs. Second, there will be pulsus paradoxes in the clinical stem. Like what is pulsus paradoxes? Whenever you inspire, there's decrease in systolic blood pressure of more than 10 millimeter of mercury. Normally, whenever you inspire, there is always a decrease in systolic blood pressure, but not as much. Like if it is more than 10, then you think of like cardiac tamponade. Okay, free wall rupture results in hemodynamic collapse as a result of cardiac tamponade. uh, I told you it is not the option. And also the most immediate and the most the first and the most immediate complication that happens after myocardial infarction, it is arrhythmia or cardiac arrest. It happens within in an hour. If you will see a patient collapsing after MI or within an hour or two or three, think about arrhythmia, or cardiac arrest. And the involvement of these are the the I'm telling you the rough or the vague things, but these are crucial. Just keep them in your mind somewhere, so you have an idea, and these things may help you in the exam. Whenever the involvement of wall, the cardiac wall, like when the rupture of cardiac wall or cardiac tamponade, it happens after 5 days, when um, after 5 days of myocardial infarction. So keep these things in mind, because it's a big complication, not the big, not that fatal as arrhythmia or cardiac arrest, but you can say after 5 days, you know the even the if you will go to the if you uh, read the pathology, you will see the granulation tissue it forms, and there it is more prone to rupture. And even after a week or two, you will see aneurysm, when the fibrosis occurs after granulation tissue or everything. So you can think like that: arrhythmia, cardiac arrest, and then valvular heart diseases like papillary muscle rupture, or then comes the cardiac wall rupture that can lead to cardiac tamponade. And after that, you have aneurysm, in which you have Q wave in ECG, the permanent Q wave. Okay, it's a clue. So that is it.